It's good afternoon, everybody. 12:30 on a bitterly cold day. Don't you think, April?
Very cold.
Really?
You're not bitter about it, though, are you?
Not too much.
Yeah.
Just gotta live with it.
Gotta live. If we live here in Effingham, that's what we gotta deal with.
It is what it is. We'll
Yep.
do what we can with that. But anyway, you're not here to bring us down about cold weather. I have no idea what you're even here for. So anyway.
You've got a lot to tell us today.
There was
Yes,
there was so much stuff listed I couldn't
You
even
didn't
begin
read
to start.
anything.
Well,
We're talking about pregnancy and postpartum.
All
Yes.
right. Yeah, I like this idea. Let's dive into this. Being a
Yes.
girl of more kids on the way here.
Yeah, so baby number 4 is on the way. So people always ask me, how did I get into pelvic floor physical therapy and why did I start my own practice? Well, one of the things was when I was in graduate school, I was the only one in my class interested in pelvic health out of 40.
Really?
So I did an independent study. I knew I wanted children in the future. I knew I'd probably have my own issues, which sure enough I do. And I do pelvic floor physical therapy every week with Katie or Kyla.
Awesome.
So I have had an unplanned C-section, a hospital-induced VBAC, and then my last one was a physiologic home birth. And baby number 4, I'm planning on so far low risk. Everything's going super smooth. So I'm planning for another home delivery this summer.
All right.
Wow.
Do you ever do anything just normal? That's what we want to know.
No, I can't be normal.
I didn't think so.
A wide variety of experiences.
Yeah, so it allows me, thankfully, to have such passion for this,
Yeah.
to be able to serve our community, whether they're wanting a repeat C-section, an epidural, a home birth, whatever it may be. I've been through it all. And I've gone to Houston to get my certification in obstetric care for treating women during pregnancy, during labor, and actually postpartum as well. So I really wanted to talk today about, it's been 1 year since our clinic started our membership program.
Has that been a year?
It's been a year.
Wow. Well, good for you guys.
Yep. We have served, in the past year, we've served 43 pregnant moms, and 23 of those are part of our membership. So we let people choose what they want to do. And people often are like, well, what does this membership include?
Yeah. Is it worth it? Is it better? It's easier. Tell us, why should we do this?
Yeah. So the membership, in my opinion, is worth doing because it saves you about $800 total. And all the classes we teach come with that for free. Like, it's included in the price. So the membership is 8 physical therapy sessions with either Dr. Katie, Dr. Kyla, or myself. We normally recommend starting in second trimester, which would give you about 6 months during pregnancy and then 6 months postpartum. It is $125 a month for 1 year that you pay for. And with that, you get your therapy sessions, plus you get a 4.5-hour birth prep class that I teach for moms aiming for a vaginal delivery. You bring your partner with you. You learn acupressure points, pain management, pushing positions for different stages of labor. And I do have that class coming up on March 1st. I will be doing 2 of those this year since I am pregnant and will be on maternity leave this summer. And then it also comes with a 2-hour postpartum rehab class. And that class is actually coming up January 28th in less than 2 weeks at Catching Glimpses.
Yep.
Jackie Orner teaches a breastfeeding basics course for us. It's a 2-hour class on breastfeeding, which is super important for moms and so many health benefits for both mom and baby. And then you get a private Facebook group. You get put into that, and you get a quarterly newsletter with education that I help write. So huge savings for doing the membership, but not everybody wants to do it. So
Understandable.
Yep, we totally will support moms with whatever they want to do.
It sounds very How did you come up with the idea to do a membership? Did you hear Dr. Comfort talking about that on Jansen's before? Because they do that membership, and I applied for that. I'm a member.
Did you?
Yeah, I am, and it's worked out great.
I think
How did you do that?
I think people just like memberships in general, and it really helps people space the cost out of their visits. So instead of paying, let's say they need 6 therapy sessions back to back to back for something they're having going on, or they come to us postpartum, they're having all these issues, instead of paying for all their visits up front, they can space that cost out. Because we don't offer payment plans. So this is not really a payment plan, but it kind of offers them a way to space the cost out.
Yeah, and it saves them some money.
It saves them some money.
And you don't have to pick and choose. You get all of it.
Correct.
And so you may not even thought you might needed this, but if it does and it works out that way, that's a great deal.
Yeah, we really want all of our moms to take all the classes so they're fully educated. So this is just a good way to say, you're in the membership, you get all the classes, come and attend.
Do you get like a lanyard or anything special thing?
No, but we do give gift bags away to our pregnant and postpartum moms.
Sweet.
Hey, tell
Yeah.
me one of those gift bags has a door prize of Prego spaghetti sauce.
So they are full. A spaghetti sauce would not fit in one of those bags.
Okay. You
All
have
right.
to carry that off separately.
Just checking.
But it's great, and we've got. I knew you before this, but I get to know you even more doing these interviews and stuff.
Yeah.
And it's like, you can just tell your passion. You love this stuff.
Oh,
and
yeah.
you like to help people out.
Yeah, so I actually brought in some props today.
All right.
Really?
So people always say, like, well, what do you actually, because this is kind of a newer thing, people weren't going to pelvic floor therapy or obstetric therapy in the past when they were pregnant or postpartum, unless it was like a severe injury during labor and delivery. But we really recommend all moms to be seen during pregnancy, starting a second trimester once a month. And then postpartum minimum, we say you need 3 visits to rehab, even if everything went smoothly. Your pelvic floor muscles are completely stretched out, or you had a C-section and now your core is weak. We want to prevent future issues. We want to prevent low back pain, hip pain, prolapse, urinary leakage, bowel leakage, all these issues that can come from childbirth. So a couple of the props I brought in an SI belt. So this is for people with low back pain. And I will see women 20 to 30 years after having babies that have had back pain, and it's coming from their SI joint.
Okay.
So this belt does not fix the issue. It helps reduce pain while we get the back and the hips and the pelvis stabilized and stronger.
Huh.
Why
this-
does that joint? Why does it? Is it just from the pushing or the baby coming out or what?
All of it.
It's,
Everything.
it's
So
a whole
honestly,
deal,
it
huh?
starts during pregnancy. Like I have this issue every pregnancy.
Oh, really?
Yeah, so your relaxin hormone, the ligaments around your pelvis have to relax a little bit
Sure.
in order for that baby to come through. So you have that, and then you have the baby, how it moves through the pelvis. So that's affecting your alignment too. No matter what position you deliver in, that's going
Yeah.
to affect it. And then also if you have hip weakness in addition to that, or muscle tightness on one side versus the other, all plays a huge role.
Wow.
Very
There's a
interesting.
lot involved.
There is, and every patient is different.
Of course it is.
Yeah, I bet.
All right, now what do we got here?
Okay, I have kinesiology tape or
Very-
K-tape. You'll see this
yeah.
on athletes. We use this on several patients, but especially our pregnant moms or postpartum moms that are dealing with, let's say our pregnant moms are dealing with like abdominal heaviness. It can help support and lift baby up.
Oh, yeah.
This
Huh.
tape can stay on for up to like 4 to 5 days. And then we can also use it postpartum if they're dealing with like a separation of their abdominals to help stabilize the abs so they can do some more core strengthening, not like your V-sits and crunches, like not that type of strengthening.
Okay, yeah.
But this will help stabilize their abdomen.
Yeah, get it back in where it's supposed to be.
And then
Okay.
the last
What
thing
you
I
got
brought
here? A
in,
bib?
What?
Oh, it's underwear.
compression underwear. Figured you guys would love this.
First time ever on our radio station. This is awesome.
So compression underwear actually has like an extra additional support in it to help women dealing with like pelvic heaviness, achiness, prolapse symptoms. It just gives that pelvic floor a little bit extra support to hold things up. So all of these things I just showed are not a fix. It's an adjunct we add in to help with treatment, to help relieve some symptoms as we're working on building up the muscles in the body.
Now, all the help you can get is better than not getting the help, I would guess.
Yes, and if we can get some people some immediate relief, that's a huge win.
Yeah, you might want to work even harder on it after you're, I'm
Yes.
feeling better now. Let's
Good.
go. Let's get
Yes.
taken care of. All right. So, ladies, if you're out there, and even guys, you guys work on guys who have
We do.
issues in that area. If somebody's having issues in that area, pregnancies or other things, how do they get a hold of you guys to get the ball rolling to better them?
Yes, so we do not require a referral to be seen. So you can just call our office directly at 217-705-5077 to get started. We are booking about 6 weeks out. So
Okay.
we always say if you're pregnant or if you know you have a baby due soon and you want to get in postpartum, call us now so you can get on the schedule for what time works best for you. I know our early morning 7 a.m. and 4 p.m. appointments, those are booking into end of like March, beginning of April.
Oh, my.
Because everybody wants those
They're
times.
popular.
So be proactive if you want to get in for therapy. So just give us a call. We'll get you scheduled. We'll take care of that. If you are a lady listening to this, we do have a free Facebook page, Effingham Area Pregnancy, Postpartum, and Pelvic Health Support Group,
Okay.
where I post, go on live about every week, every other week we post different things in that. So just like educational topics, people can ask questions. So that is available as well. And then the last thing I wanted to say is we have our holistic health fair coming up here in Effingham.
Yeah, when's it this year?
It is in 2 Saturdays. So Dr. Seberg and I will be on the radio next week talking about that health fair, but it is January 25th, if I said that right. Yeah, 2 Saturdays, January 25th, 8 to 11 a.m. at the First Baptist Church. It's a free event for our community. We have, I think, 18. We maxed out. We have 18 businesses coming, and we'll have different speakers. There's going to be some great raffles, free massages given away, some gift cards to like Workman Complex, different things like that.
Very nice.
So yes, people have been very generous with donating raffle items to us.
And today we've been talking about, and you've been talking about, a lot of pregnancy before and after, but you cover a lot of different things with pelvic health, and the holistic health fair is a whole nother aspect of things.
You got it. And I like to be very collaborative with all providers, so chiropractors, counselors, all that. So lactation consultants, midwives, so they'll all be present.
It takes a village, I tell you.
It does. It really does.
All right, very good. Well, that sounds awesome. I know it's been a great turnout for the past, is this the third one you've
Third
had?
year.
All
Yep.
right. Well, good luck on that.
Yeah.
I'm sure
Thank
it'll
you.
be awesome. Just hope the weather is good,
Cooperates.
how it is around here. But we'll do the best we can on that. Anyway, Dr. April, it's always a pleasure to see you. I guess you got to go back at it.
I get out in the cold.
It's nice and
man.
toasty
It is
warm in here.
toasty in here.
All right, we'll see you later, and have a good one, okay?
You guys too. Thank you.
BD, talk to you on the